All right. Hello, everyone. My name is Bree Kimberline. I am a nurse here at North Kansas City Hospital in Community Health and Wellness. Thank you for joining us today for our presentation, Fueling the Fight, the Role of Nutrition in Cancer Care. So our presenter today is Angie Boxberger. She is a dietitian at the North Kansas City Hospital Cancer Center. Angie's been board certified in oncology for 8 years, and she's worked in the cancer center setting for over 12 years. She is a graduate of Missouri State University. That was SMS back in my day. Remember
Yes.
that? Yeah. And she got her master's degree at KU Medical Center. She enjoys traveling with her husband and her dog Parker, who is a long-haired dachshund. So Angie's going to touch on the big role that nutrition plays in oncology, right? Whether it's diagnosis, treatment, recovery. There's so many things that go into that. Nutrition is just such a huge thing in our lives, period, right? So whether it's maintaining your energy and your strength or supporting your immune system or managing side effects, we're going to touch on all that stuff today. So help me welcome Miss Angie. If you have questions, please put those in the chat and we'll get those at the end. And thanks for joining us. Take it away, Angie.
Yay. Thank you so much for having me. I'm excited to be here with you today to further elaborate on how important nutrition is during the cancer care. And I think Bree really hit the nail on the head when, she was saying that it's such a crucial part of the whole process. And I think one of the things that we often forget about is nutrition during cancer looks so very different depending on what stage you're at, but it matters dramatically in all the stages. So today we're going to talk about, not only what it looks like during treatment and why it matters, but also what it looks like when you've got hiccups in the road, which we all know that treatments do. So as we get into this, my objectives for today would be to specifically review the role of nutrition during the cancer treatment process. So this would be during active treatments and why it matters so much. And then also to review the ways that you can optimize your nutrition even when you have these different treatment side effects that are potentially impacting your desire or even your ability to actually eat. So let's dive right into why does nutrition matter during cancer treatments? And I think it's so important to know that there's a variety of reasons that your nutrition needs just skyrocket during the cancer treatment process. One is specifically just that cancer cells themselves have a very high metabolic rate. So they're just burning through a lot of nutrition anyway. So simply the presence of cancer in the body increases nutrient demands. And then the second piece of this is that as we give these different treatment modalities to treat cancer, these processes also increase nutrient needs. So what happens is all these different treatments, as you can see listed on this slide, surgery, chemo, radiation, immunotherapy, targeted therapies, transplant, all of these different processes increase nutrient needs because they're targeting the cancer cells. But what happens is that your healthy cells are also getting a little bit of this impact. And that's why we see these side effects because your healthy cells are getting a response to the treatment as well. The good news is that your healthy cells have the ability to regenerate, which is amazing. That's how you heal and recover. But in order to do that, your healthy cells are going to need a tremendous amount of nutrition in order to heal. So we've got multiple factors going on here that result in increased nutrient needs throughout the process. So when you're getting nutrition or adequate nutrition, let me say that adequate nutrition during cancer treatment, the benefits are wild. And it's one of those things where, I think common sense, we probably all know that yes, nutrition during cancer matters. But if push comes to shove and someone were to ask you, but why does it matter? I think we don't always know all of the reasons for that, or that's not public knowledge. So today I wanted to review some of those things because it might, if you're going through the cancer treatment process and you understand exactly how nutrition plays a role in so many of these different parts of your experience right now, it makes it a lot easier to try to prioritize nutrition and give it the attention that it should have. So when we see adequate nutrition during cancer treatment, here are some of the benefits that you can expect. We can see reduced severity of side effects. This is huge. We all know that different treatments have different reputations for being just, pretty uncomfortable, pretty miserable at times. And if we can reduce the severity of how you experience some of those side effects, that's magical during this process, right? We want to make this more tolerable for you so that you don't feel so crummy all the time. And then part of that, the second piece of this is that it actually helps improve your treatment tolerance. So when you're not feeling as bad, you can actually get through the treatments feeling a little bit stronger, a little bit better. And what this actually does is it helps you to stay on track with your treatment regimen. So let's say that, for example, you have really bad nausea and you can't eat much. Maybe you're throwing up a lot. You're losing lots of fluids. Sometimes, your labs might be off. This could result in potentially treatment breaks. And, that's sometimes happens and sometimes unavoidable. But if we can keep up with your nutrition and we can help manage some of these side effects, we might be able to see that we don't have to have those treatment breaks. And your treatments are designed, whether it be chemo or radiation, whatever, they're all given in a dosage that's expected to give you the best treatment option for your cancer type. So the best thing that we can do is really try to nourish your body so that you're able to get that treatment as it's prescribed by your doctor for the purpose that we want it to be given. So we can also see reduced hospitalizations, right? Let's go back to this nausea example. If you're so sick that you can't eat, you become dehydrated, your labs are all crazy because you've just been losing fluids, that's really hard to manage on the outpatient side. And a lot of times what happens is we might do direct admissions to the hospital just to be able to get you kind of tuned up so that we can get you safely home again. So, we don't want that for you. And I don't know very many people that want to go in the hospital. So being able to stay on top of nutrition can help reduce those hospitalizations. And it's also going to reduce malnutrition risk. And malnutrition during cancer is a huge indicator for how well you do treatments and respond to treatments. So we definitely want to minimize that malnutrition risk as much as possible. Quality of life. This is a big one because how you feel during cancer treatments matters. Okay. We care about you. Your treatment team cares about you. We want you to feel as best as possible, knowing that, there's some not ideal side effects that come with cancer treatments, but we want you to feel as best as possible so that you can continue to do things that you like as much as able during this process. So if we can improve your quality of life, that's a huge win for you and for your treatment team as a whole, because that's what we want for you. And then this is potentially one of the more exciting benefits of adequate nutrition during cancer, and that's that it promotes faster recovery when treatments are done. We love that so much because you don't feel great during cancer treatment, and we want you to shift out of that space as quickly as possible when treatments are done. So if we can stay ahead of the game and stay on top of your nutrition during that process, we're going to see you bounce back a lot quicker when treatments are done, and it's going to shorten that recovery window, which is wonderful. We get you feeling more like yourself much faster. So as we see your nutrition needs go up during treatment, we also see that usually because of side effects, your desire to eat goes down. Okay, this can be because of a variety of reasons, usually related to the cancer treatments or maybe even just the cancer itself. So this might look like pain. Maybe that pain gives you nausea. Maybe that pain is just so distracting it completely cuts your appetite. We can see reduced appetite for lots of reasons. GI side effects like constipation, maybe reflux, nausea, things that would just make sense would reduce appetite. We can also see side effects that actually reduce the ability to eat. This might look like a sore throat. Maybe you have trouble swallowing or chewing. Maybe you've got mouth sores, different things that can come into play that actually impact the physical ability to chew, swallow, and eat. And then another one that, we see all the time is fatigue. And fatigue can actually play a role in how well you nourish and eat during treatments. Because if you're very tired, it can be, we don't normally think about eating requiring a lot of energy, but it actually does take quite a bit of energy to eat and chew and swallow. And then on the backside of that, like your body takes a lot of energy to digest. So fatigue can definitely reduce appetite as well. So what we see here, this little graph that I've made at the bottom, This yellow line indicates your nutrition needs going up. And this green line indicates your nutrition intake, which usually starts to decrease as you go through cancer treatments. So once we find that crossover where your nutrition intake is less than what your needs are, that's what I would consider the danger zone. Okay. From a nutrition standpoint, this danger zone is where we see risk of weight loss and complications that are derived from basically a lack of nutrition. Okay. And that can lead to lots of complications. So what we want to try to avoid is ever getting to this crossover point where within this box, we're kind of in that nutrition danger zone. So let's talk about what these different nutrition or different nutrients that you need during treatment. Let's talk about what those are. And the big ones are going to be your macronutrients. So that's where we're going to spend a lot of our time today versus what we would consider micronutrients, which are going to be like vitamins and minerals. You do need those. But for the sake of today's talk, I want to focus on macronutrients because that's where we're going to put most of our emphasis when we're looking at nutrition during cancer. So our macronutrients are going to be the nutrients that actually give us energy and give you calories. Okay. So a big one that you probably already know about is protein. And this is the macronutrient that's responsible for tissue repair. So think about your healthy cells needing to recover. That's where protein is going to come into play. It also matters for building lean tissue or like muscle mass. But I also want you to think, aside from just your muscles, like your biceps or maybe your legs, think about other things in your body that are considered muscle, like your heart. That's considered a muscle. There's a muscle underneath our lungs that helps our breathing, called your diaphragm. These are all important pieces, of the body function that we also don't want to become weak during the process. Protein plays a role in your immune system function. We all know that as you go through cancer treatments, typically we tend to see your immune system go down a little bit. So we want to make sure we're getting ample protein to make sure that we're really helping to support that immune system function. And then protein also, I don't see this as often during cancer treatments, but it also helps with keeping you full. So if you were someone who, let's say, didn't have trouble eating and you ended up on the side of things where maybe you're eating too much or you were gaining weight during treatment, we'd want to make sure that you're getting enough protein to make sure that what you're eating is actually sticking with you and keeping you fuller for longer. So this is more valuable if, let's say, you're trying to reduce weight after treatment to reduce cancer risk so that you're at a healthy body weight. That's where this would play an important role. But usually that's not the case during cancer treatments. So our protein foods are going to be really anything that comes from an animal. So this could be meat, poultry, fish, eggs, dairy. That's the easy rule of thumb is anything that comes from an animal, but we can also get protein from a lot of our plant foods. So this would look like our beans, nuts and seeds, and then soy products. The second macronutrient that I want to talk about is the carbohydrate family. And this is such a powerful nutrient because our carbohydrate foods are the ones that are our body's preferred source of energy. Okay, so it's the primary function of our carbohydrates is to fuel all of our cells in our body so that they can do the jobs they're supposed to do. This is specifically important for our brain and our nervous system. Our brain has to function on carbohydrates, so we want to make sure that we're including those foods. And then as we know, your nutrition needs are going up during treatment. We already talked about that. So we want to make sure that we're actually giving our body the fuel that it wants in order to be able to do all those processes for repair and recovery. Our carbohydrate foods are going to be our milk family, yogurts, any type of grain. So rice, pasta, breads, biscuits, all that type of stuff, anything with flour. Beans and lentils would also count as carbohydrates. Some of our starchy vegetables like potatoes, corn, and peas. Not all of our vegetables, just our starchy ones. And then our fruits. And then, of course, any sweets or sweeteners that would have actual calorie content. So like honey, sugar, jam, that type of thing, maple syrup. And then the last macronutrient I want to talk about today is our fat family, okay? The fats in our diet are going to also be used for energy for our cells. It's not the primary source of energy, that's our carbohydrates, but fat does play a role in energy as well. But it also helps with the absorption of certain vitamins and minerals. So we're not going to spend a ton of time talking about those today, but know that when you're eating certain vitamins and minerals, a lot of them will require fat along with whatever it is that you're eating in order for those to actually be absorbed and utilized in the body. And then fat also plays a role in insulation and organ protection. So we like that. We like our organs to be supported and protected. So we want to make sure that we're including some of these foods that might be oils, butters, avocado, coconut, nuts and seeds. Some of our meats will have high fat, as well as fatty fish. Now, while water is not considered a macronutrient, I do feel that it's important enough to talk about here because, it is absolutely essential for life and is used in almost every single cell pathway in our body, metabolically. So we want to make sure that we're getting adequate fluid, but it's also super important during cancer treatments because the risk of dehydration during cancer treatments is so high. So we can have different side effects that might cause fluid loss, like vomiting, diarrhea, things like that. Or you might just not be taking in as much. If you're not feeling well or you're just very tired, we tend to see you just not drinking quite as much throughout the day. And that can, over time, result in some dehydration. I also have people tell me, that they just don't want to get up or they don't go to the kitchen as often. So they end up not drinking because they're just not passing a source of fluid, whether it be the fridge, the sink, whatever. And your body might not be as reliable right now at telling you, hey, you're thirsty. So your thirst cues might be impacted as well. And remember, when you're getting certain treatments, we really want to be flushing the body and supporting the natural detox systems of the body. I don't love the word detox from, a standpoint of what's seen on the internet. The word's often not used correctly, but our body does have natural detox systems, and a big part of those functioning well is adequate hydration. So we definitely want to utilize whatever resources we can to make sure that we're getting enough fluid in the body. So the important thing to remember is that we need a balance of all of these macronutrients. So you're getting proteins, carbs, fats. We want to get a balance of those every day throughout cancer treatments. But, the problem is that this can be really, really difficult to do when you're having side effects that impact your ability to eat. Right? That's the big crux of it all. I could be going through all this, and if you're going through cancer treatments, you might be thinking, well, Angie, a lot easier said than done. If you don't feel like eating, you've got pain, nausea, whatever. So we're going to talk about some of these things so that you can walk away with some tools to help support you through this process. Okay, I want to spend some time today talking about some of the top side effects that we see in regards to how it impacts your nutrition during cancer treatments. And I want you to walk away, if you're experiencing any of these items, I want you to walk away with some actionable steps. So we're going to review those today, and then I will send this presentation out to Bree whenever we're done so that you can have access to this if she sends that out along with the recording. So let's start off with poor appetite. This one is pretty common across the board. I see this with almost everyone that I work with. So tips to help get around this is that if you have a poor appetite, you're probably eating a lot smaller portions at your meals. And what this means is that 3 meals a day might not be appropriate for you anymore. You might be somebody who does a lot better with smaller, more frequent meals. So I would suggest taking the pressure off your shoulders that you have to eat 3 big meals a day and try to break it down to what does this look like if we're doing more of a grazing meal pattern. So let's look at this like 6 to 8 small, I don't even want to say meals, let's say snacks per day. You can absolutely get all the nutrition you need by doing just small chunks, and we're breaking it down to like every 1 to 2 hours. I have lots of people that have a lot of success with this eating pattern. So know that you have permission to adjust meals and snacks however they need so that it's functional for you. When you're eating these different foods, we also want to focus on high calorie, high protein. Because if you're not eating as much, we got to figure out how do we get the most bang for your buck in the foods that you are eating. So we want high calorie, high protein foods. This is also where it can be really helpful to incorporate liquid forms of nutrition. liquids tend to digest or flow through our system past our stomach a little bit quicker. So if you're someone who doesn't want to eat a lot or don't have much of an appetite, you might do better with some liquid forms of nutrition that just take less energy to get down, less preparation, and they just pass through your system a little bit quicker. Another great tip is to try to pay attention to your day. When do you feel best and when do you feel like you can optimize a little bit more? For many of my patients, they find that this is best in the morning. So if you're someone who, you notice that as the day tapers on, you don't feel like eating as much, then let's try to optimize earlier in the day and try to front load your day so that you can feel a little bit more ease as the day goes on versus feeling guilty about not eating enough. And then I would also advise you keeping lots of easy, ready to go foods on hand. So that way you're not having to put in a lot of work when it comes to getting foods on the table, because if you don't have much of an appetite, you're not going to have a lot of motivation for cooking and prep. Makes total sense. So let's get some easy foods in the house that really are just waiting on you, ready to go. And then another thing that's not really nutrition related, but I always like to mention, is that if you can incorporate any amount of light movement, like a little bit of walking, even if it's just putzing around the house, sometimes this can also trigger appetite. So that's not a bad thing to do if it's a time that you feel like you're about ready to eat and you don't really feel that hungry. Try doing a little bit of movement for 5 to 10 minutes and see if that helps trigger a little bit of an appetite. Okay, let's talk about nausea. This is another really common one. With nausea, similar to the previous slide, I would suggest very small portions and eating often. The last thing we want to do if you're feeling queasy is bombard your stomach with a huge meal. It's just not going to go well. We want to do small amounts that your stomach can work on and tolerate in just very comfortable portions. I would also advise choosing really easy to digest foods. So this is going to look like a lot of bland or starchy foods, maybe even clear liquids if it's a day where the nausea is particularly bad. And then even trying colder room temperature foods. And this is because those foods tend to have less of a smell. If you can imagine hot foods, usually the plate's steaming, and that sometimes that smell can trigger the nausea to start. So if we can avoid any of those types of smells, that can help us out. Avoiding greasy or high fat foods. These types of foods are going to be a lot harder to digest for your body, or they just take longer to process if they're really greasy. And anything that's going to take longer to process for digesting is just going to be a no-go when you're having nausea. We want, again, remember, easy to digest foods. So we don't want to put things in the system that are going to make it really hard for your stomach to have to work pretty hard. We already talked about avoiding some of those odors. So that can be not only when the food's on your plate, but also, let's say, if someone's doing the food preparation in the kitchen, maybe you need to be elsewhere. If the kitchen is starting to smell like dinner, that's probably not a place for you to be, because if those smells happen to trigger the nausea, you're going to be off-put by the food even before it's on the table. So step outside, go to a different room, shut the door, whatever you need to do to separate from that space where that cooking is happening. Utilizing things like lemon drops, mints, or even ginger chews can be really nice for helping manage nausea. It's not a perfect cure for nausea. However, it does support a lot of people or makes the nausea a lot more manageable. This can actually work by triggering your vagus nerve onto different flavors, which can actually help reduce the nausea. So there's actually some science behind why these little tricks work. And then I would suggest, if you're feeling queasy, don't lay down right after eating, okay? Definitely take some time to rest so that you can just let your system focus on what it needs to do to process your food. We don't want you going running around or anything like that. You probably wouldn't anyways, but we just want to give your stomach ample time to process. But make sure that you stay somewhat elevated versus lying down, because we want gravity to work in your favor, keeping food down. Okay, taste and smell changes. This is another one that's quite common and can definitely even trigger nausea or just decreased appetite. If you're experiencing taste changes and you're not already using some type of oral rinse, I would highly suggest getting this on board. You can use commercial rinses, like Biotine's a big brand, or Act is another brand of mouthwash that's alcohol free. Those are, I would just make sure if you're using a commercial brand that you're looking for an option that's alcohol free, because the alcohol in your mouth is going to be very drying and not ideal for this point in time. But using a rinse that can help cleanse your palate is going to be really helpful when you're going through these different changes. You can also use a homemade rinse, which I personally love because it costs literally pennies. You can make it out of just water, baking soda, and salt. And you can use this as many times a day as you need, just to kind of reset the taste that you might be experiencing. And you can use it before meals to cleanse the palate. You can use it after meals if you have lingering tastes, or really just whenever you need to help, start that clean slate basically on a flavor standpoint. So if you're experiencing, there's lots of different styles of taste changes that we can see during this process, but if you notice bland taste, try to overly season your foods. It might mean that whoever you're eating dinner with doesn't want to eat the food, but you can just season your own plate, but definitely use a heavy hand with some of these seasonings, or use marinades, dressings, sauces, things like that. You can also add really strong flavors like lemon, vinegar, pickles, things that are going to be just really pungent to help you detect some of those tastes whenever everything tastes bland. If you're experiencing things more on the bitter or metallic side, I would stop using metal silverware and I would switch to using either plastic or bamboo utensils for the time being. Just because if you're tasting metallic, we don't want to put a metal fork in your mouth. It's just going to enhance that flavor. Same thing applies for using like stainless steel equipment. So if you had a stainless steel cup, or maybe a straw, that's pretty common. Let's switch to a plastic straw. They make lots of like silicone options anymore for that. If you're doing like a cup, make sure that you're using a plastic cup, or maybe even a glass type of vessel versus stainless steel. And then sometimes even choosing like sweeter flavors or fruit flavors can counter some of that bitter metallic taste. And then when it comes to our protein foods, red meat tends to enhance metallic tastes. So what that means is that if you're trying to keep up with your protein, you may have better luck with fish, poultry, eggs, beans, tofu, things that aren't red meat, okay? The reason for that is that red meat is really high in heme iron, and heme iron can have that metallic-y taste. So trying to kind of be smart or strategic about your protein foods can help you out in this area. And then going along with the metal exposure, basically, anything that's in contact with metal, it doesn't mean it has metal in it, but it might take on some of that metallic flavor. So you might find that you do better with frozen vegetables versus canned vegetables. Canned vegetables might enhance that metallic flavor. Okay, let's move on to salty taste. If you have salty taste, makes a lot of sense. You might gravitate towards sweeter flavors. So definitely just lean into those foods that taste a little bit better to you. You might also find that boiling some of your food can help reduce or leach out some of that salt. So it might make it more tolerable for you. Let's say if you boiled, like let's say you're going to have canned vegetables, those typically have salt. If you were to boil that in some water, like rinse and drain them, boil them in some water, it's going to help leach out some of that salt so that the food itself is less salty. And then, of course, just trying to use low sodium or no salt added products. We want to try to reduce any of those unpleasant flavors for you. If foods are tasting overly sweet, again, we're going to want to do the opposite. So you're going to be choosing bland flavors, maybe even sour flavors. And keep in mind that you can always dilute things. So let's say that you have something sweet that you're drinking, like juice, or maybe if you're someone who likes protein shakes like Ensure, Boost, or any of the other ones that are on the market, you can always dilute those down so that they don't taste as sweet. You can dilute them with water, you can dilute them with milk, your choice, but don't be afraid to modify your options so that it works better for you. And then because fruits are naturally sweeter, you might find that you do better with vegetables over fruits if you're adding those types of foods to your plate. If you are sensitive to smells, this is very closely related to our taste. So you might notice a lot of smell sensitivity, and that can trigger appetite or even taste changes. So avoid heavily fragranced products or foods. So this kind of goes along with what we were talking about a little bit earlier. Remove yourself from the space where the smells are. And then choosing those cold room temperature foods that have less of an odor can be helpful. Avoid strong smelling foods. Certain ones that come to mind are like fish, cabbage, eggs, anything that would just put off like even seasonings, like some of our strong spices that we might use in cooking could have an off-putting smell to you that then may trickle down into your taste. Okay, let's move on to a little bit lower GI. So constipation is a big one that we see. This can be a result of just cancer itself, but it can also be a side effect of many medications that you might be on, like anti-nausea meds, or there's lots of different medications that just chemo meds, things that can cause constipation. So want to make sure that you're drinking ample fluid. You've got to put emphasis on adequate hydration to help manage your fluid or your bowels. Okay. Drink extra fluid if you're using high fiber foods or fiber supplements. Okay, so if you're someone who uses like a Metamucil or a Benefiber, we got to be adding in extra water because fiber can only work as well as the environment that you hydrate. Okay, those two things go together like two peas in a pod. So we got to make sure that we have those together. I would suggest aiming for at least 25 grams of fiber per day, whether it's from dietary sources or whether you're using a fiber supplement. Fiber is going to help really move things through your system as long as you have adequate fluid. So aiming for that higher number is going to help move things along. And you're going to get this from your fruits, your vegetables, whole grains, beans, that type of thing. Hot beverages can sometimes trigger bowel stimulation. And so I would suggest trying to incorporate maybe hot teas, maybe a cup of coffee. And then light movement is also very helpful for GI system as well. So if you think about it, you know, if you've got things stuck up in your system inside, the more you can kind of move and manipulate your body, the more it's going to help manually push things through a little bit. So think about things like even stretching or walking, just any type of light movement that you can do is generally helpful for bowel movements. And if you're doing all of these things and it still isn't helping, it's also 100% appropriate to let your doctor know. I would suggest doing this anyways, because they might find that based on whatever struggles you're having, they might find it valuable to put you on some type of bowel regimen. Let's say you're having issues in the opposite direction. Let's say that you're having diarrhea. I would encourage small, frequent meals. I would also keep up with fluids, but this time for a different reason. It's because you're having lots of fluid loss, and we want to make sure that you're replacing those fluids. I like to add on this little extra tip of if you're having diarrhea, for each loose stool that you have, you need to drink an extra 8 ounces. I know that sounds like a lot, but we lose a lot of fluid. And we already talked about the risk of dehydration and hospitalization. So to keep you well and at home, we want you to be really proactive about fluid. I would also actually recommend using electrolytes in those fluids. So whether it's Pedialyte or there's lots of, like a Gatorade, a Powerade, something like that, or lots of different electrolytes are now available in the market that you can just add to your water when you're losing fluids via diarrhea. We lose electrolytes in addition to the fluid. So we want to make sure that we're replacing those. I would try including soluble fiber foods. So with diarrhea, we want to be very careful about what we would consider roughage. So I wouldn't do like salads or whole grains, nuts and seeds, those things that we consider roughage in the diet. But doing soluble fiber sources like bananas, oats, white rice, or even like mashed potatoes, those can actually help bulk up the stool and absorb some of that liquid so that the product isn't a loose stool. Do keep in mind that caffeine and spicy foods are a bowel stimulant. So if you're having diarrhea, the last thing we want to do is stimulate your gut to move even more. So caffeine and spicy foods would be advised to just table for the time that you're having looser stools. And then the same rule applies here. If you're having diarrhea, I promise you, your oncologist wants to know about it. So please don't be shy about bringing this to the table. They want to make sure that they can manage this for you, especially if you're trying all these other things and it's simply not working. Okay, let's talk about sore mouth, sore throat. We can see this from radiation to the head and neck area. We can also see this just from mouth sores from certain chemotherapies or immunotherapies. Seems pretty straightforward, but I always like to reiterate, if you're having sores, we want to make sure we're avoiding anything that would be painful. So that means avoiding acidic foods or avoiding spicy foods. If you can imagine having a sore throat, we just know that those foods don't really make sense. It wouldn't feel good to have those. So we want to be really careful with certain seasonings, spices, acidity, things like that. We also want to choose foods that are really soft and moist. We want to think about what's going to be the easiest thing to swallow with the least amount of friction. So we're looking at soups and casseroles, things with gravy and sauces, just to make everything really easy as it goes down. Hot foods can also be uncomfortable. Think about it. If you're sore, it's, we don't want to put something hot or that would feel like it was burning on those sore areas. So think about room temperature food or cold foods being a little bit easier to go down. Liquid nutrition with low acidity. Okay. What this means is probably not orange juice. Okay. Probably not V8 juice. Things that are going to be highly acidic. Things that are going to be highly acidic aren't going to be very comfortable for you to swallow. So we want to think about nutrition that might be liquid, easy to go down, but we want to use caution with some of those acidic options. I would limit carbonation. Again, all those little bubbles might not feel very good if you've got mouth sores or a sore throat. And then I would avoid alcohol and alcohol containing products. So we talked about like those mouth rinses. You just want to make sure that you're getting an option that doesn't have alcohol. Reasoning for that is the alcohol is very drying. It's going to make those sores, sore throat, sore mouth much more painful. Okay. If you think about like if you've ever had a scab on your arm or whatever, as the skin gets dry and it kind of tugs, that becomes painful. But if you were to put like Vaseline or Aquaphor on it, it feels a lot better. So it's a kind of that same concept. We don't want to put drying agents in the mouth or in the throat if you're having any of those sores. Okay, dry mouth. Again, some of this might be really intuitive and you might already be doing this, but it's advisable to just pay attention to some of these things. So let's alternate bites and sips, okay? We want to keep that moisture in the mouth and we want to take small bites so that your saliva can be most effective versus if you put a lot in your mouth at one time. So small bites, chew well, alternate bites and sips. Adding sauces, gravies, anything to make the food more moist is also going to be very helpful if you have dry mouth. Keep a water bottle with you at all times. It's your little sidekick. You want to carry that in the car, to appointments, all that, so that you always have it accessible so you can just stay on top of little sips all day long. If you are having, one of the things that we can see with dry mouth is that your secretions end up being thicker. So you might have a dry mouth, you still have saliva, but the saliva is a lot thicker, right? So we want to make sure that, if you're experiencing that you can kind of spit out some of that thicker saliva. And one of the things that can be helpful is one of those mouth rinses that we already talked about, or using like a club soda, as long as it's not sore, you could use something like that to kind of break up those, that thicker saliva. If you have a humidifier at home, this is a really valuable thing to add, especially at bedside at nighttime. If you think about it, if you're sleeping, hopefully for 8 hours a night, you're not drinking that whole time unless you're waking up in the night and sipping stuff. So we want to make sure that we're keeping moisture in the air, that you're breathing all night long. Lozenges or frozen fruit can also be really nice, or even ice chips. We want to think about what's going to add moisture to the mouth. So if you're adding lozenges like a lemon drop or a ginger drop, things like that, it's going to stimulate saliva production. Frozen fruit can do the same thing, or ice chips. That's just going to add straight moisture to the mouth. Let's see. We already talked about those other two. Okay, let's move on to fatigue. This is probably without a doubt the most common side effect that I see across the board for all different treatment types. So when it comes to fatigue, we already talked about this a little bit, but I want you to think about doing smaller meals more often. If you're tired, you're going to get very tired very quickly at meal times. So we think about, let's just try smaller amounts more often, and let's see if that makes it a little bit easier for you to get in your quota for the day by the end of the day when it comes to nutrition. I would also consider using liquid nutrition or supplements like Ensure, Boost, Premier Protein. There's so many different ones on the market. So really choose one that you like, that's going to get you high nutrition, high calories, high protein. That's what we're looking for. But liquid nutrition just takes less energy to eat. So if you're tired, we don't want you to eat something that's going to make you chew for 10 minutes just to swallow, right? So we want things that are really easy to go down, things that don't require prep work. So keeping lots of snacks on hand, just easy things to go. That's what we're looking for in terms of fatigue. So use those pre-made foods. This might be that time and place where things like microwave meals come in handy because it doesn't require any kitchen work other than pushing the buttons on the microwave. So this is where we utilize those really convenient, easy to eat foods. I know that this sounds very counterproductive, but the number one thing that you can do to reduce cancer-related fatigue is actually to exercise. I know that sounds probably like the last thing you want to do when you're feeling fatigued, but even small amounts of movement can actually help counter the fatigue. The less you do from an exercise standpoint when you have fatigue, the worse the fatigue is going to be. Okay, so to keep you out of that cycle, try to do just small amounts throughout the day, best you can. Okay, so I want you to remember that during cancer treatments, your calorie and your protein needs are an absolute priority, okay? The focus should be less on the types of foods that you're eating, and there should be more emphasis on choosing the foods that are going to support the side effects you're having. We talked about so many ways to tweak your nutrition depending on what you might be experiencing, and I want you to know that it's perfectly okay to do that. One of the things that people often come to me struggling with is that they feel like they should be eating a certain way, but physically their body just isn't allowing them to. I want you to know that if there is any way that you can eat nutrition that supports your body despite the side effects, that's the way to go. Okay. We want you to fuel the way that your body is allowing you to do. We can shift once those side effects resolve, we can shift the way that you eat. And that's the way that typically it goes. But we're only going to support your body from a nutrition standpoint if we're managing nutrition around your experience based on your side effects. So remember that eating enough calories, enough protein is going to make a far bigger impact on your treatment process, tolerance, quality of life, and even recovery versus if you're trying to eat perfectly. And then I did like to mention here that if your side effects that you're having from treatment isn't impacting your ability to eat too much, we actually do recommend that you start survivorship guidelines as soon as possible, even if you're still actively in treatment. But this is only if you're not having trouble eating. Okay, if you're having trouble eating, you want to go off of all those different recommendations we already talked about. If you're not having trouble eating, this is where you can start incorporating some of these nutrition guidelines for survivorship. And this looks like adopting a plant-based diet, which does not mean vegan or vegetarian. It just means incorporating more plant foods and aiming for about 30 grams of fiber per day. This helps reduce cancer risk or risk of recurrence. You don't have to completely cut out red meat, but the guidelines currently stand at trying to limit to 18 ounces per week. More than 18 ounces per week, we see increased risk of certain cancer types. So that's why that guideline is there. We do suggest limiting processed meats as much as possible. This is going to be things like deli meats, bacon, sausage, things like that. Limiting sugar sweetened beverages. So things like regular sodas, maybe high sugar, like coffee drinks, things like that. And then reducing heavily processed foods or refined sugars. You don't have to cut out sugars completely. You don't have to cut out processed foods completely, but the ones that are very, very heavily processed, we just want to eat those less often. And then also guidelines to use supplements if your doctor recommends them for you, but do not use supplements as a means to prevent cancer or reduce risk of recurrence. So in summary, nutrition can greatly improve your cancer treatment process, even into the recovery phase, which is huge. We want to aim to increase calories and protein while maintaining a balance of the carbs, proteins, and fats, which are your macronutrients. We want to modify nutrition during the treatment window to support cancer treatment challenges that might impact your ability to eat. And then we want to transition to survivorship nutrition guidelines once the side effects resolve in order to help reduce risk of recurrence down the road. So that is all I have for you, but I would love to open it up to questions.
Do you got any questions for Angie? Linda said, excellent information and presentation. I agree. You gave such good, like real world examples.
Yeah.
which I think is super helpful.
Yeah.
I
Action
have
step.
a question. Okay,
Yeah.
so like say you are watching this maybe because your family member has cancer or is going through treatment. As a caregiver, have you do you have any recommendations to help ease that? Because you want to help, right? It's your
Yeah.
loved one. You want to help them. You want them to eat. You want them to get better. Do you have any recommendations there?
Yeah. So as the caregiver, this process is extremely hard. Um, and just different from the person who's actually going through the treatment process. And it's a very delicate balance. And, it's just hard because it takes a lot of communication. And as a caregiver, one of the best pieces of advice that I can give is really try not to take things personally. I've seen this over and over and over. It is such a blessing for patients who have a caregiver or someone that's helping support them through the process. But a lot of times, someone who's going through cancer treatments and really just feels unwell and honestly quite miserable most of the time, they're not acting like themselves and they might be more prone to like lashing out or just being really short with their loved one or caregiver. And from the caregiver standpoint, that can be really challenging because you're just trying to help and it feels very hurtful, right? But remembering that, it's very much a balance. Try to support with the tools that you can, but also know that ultimately the person going through treatment has autonomy for what they're going through and experiencing, and it's important to honor that and just try to be the best support that you can. Give them options, try to be there and offer options, but at the end of the day it has to be the patient or the person going through it that has to decide what they do or don't want to do. And that's a very difficult place to be as a caregiver because you just want to do everything in your power, but remember that you can only meet the patient halfway. Okay. So that's just a really important piece, I think, to remember. Be there in the capacity that you can, but also know that the weight of the world in this situation isn't on your shoulders as a caregiver.
Two good points.
Yeah.
Gotta,
That's tough.
especially as females too, we want to be
Yes.
a fixer
Yes.
and we take care of everybody already. So it's got to be a two-way street.
It is. It absolutely is.
Are you seeing any kind of new research coming out or any kind of new treatments that get you excited or, that you're kind of like, ooh,
Yeah. So there's always new treatment types. And of course, I'm not on the cutting edge of it like our physicians are here at the hospital, but it's really exciting to me to, even when I'm involved in the like tumor conference meetings to be hearing about new trials or things that are happening. I am particularly excited about just advances. Specifically, I spend a lot of time working with radiation patients or patients that are getting radiation therapy, and the side effects are quite brutal for radiation for certain cancer types. And I'm really excited about proton therapy, which is expanding across the United States because it treats the cancer, but reduces the amount of healthy tissue in the body that gets some of that radiation exposure. So that's very exciting.
it's cool.
Um, yeah. Anything to make the process more comfortable is very exciting.
Yes. Anybody got any other questions? Well, like Angie mentioned before, we will include your PowerPoint in the follow-up email that I'll be sending out. You've got her info there on the screen. Please reach out. And I want to thank you, Angie, for a wonderful presentation. It really was very informative. I learned a lot, and I hope you guys that watched learned a lot too. And make sure that you go back to nkch.org to see what other presentations we've got coming up because we kind of have a new cancer line coming out, right? We've got a whole new cancer center and new physicians and new treatments, and we want to just educate our community and let you know that we're here to support you. So please go there to see what else we have available. And our YouTube channel has tons of content, not only about nutrition, but mental health, heart disease, etc. So thank you for tuning in, and I hope you guys have a great week. Bye.